Hello, everybody, and welcome to the Hughes Clues. This is part 2 of the clinical application of the hemodynamic principles. We've already talked about some of the reasons why a hemodynamic catheter or pulmonary artery catheter is utilized, and now here's one more. To remind you about the pulmonary artery catheter, it is called a pulmonary artery catheter because the tip of the catheter is located in the pulmonary artery. So it is initially inserted into one of the big veins. It could be a subclavian or an internal jugular, and then it can go in through the inferior or superior vena cava through the right atrium, right ventricle, and then it lives out in the pulmonary artery. And if you notice with this catheter that the tip of it is in the pulmonary artery, and then the other tip or the other end of the catheter, there are ports. And these ports can be connected to pressure monitoring pressure lines. And so we can get waveforms, but we can also draw blood from the catheter. And you can put devices and things on there so that pulling blood is much easier. So why would we do this? Why would we want to aspirate blood from the pulmonary artery port? Well, the blood that's aspirated from the pulmonary artery port is considered to be mixed venous blood. Yes, we know that it is called a pulmonary artery, but the vessel carries deoxygenated blood. And where does that blood come from? Well, it comes from the superior vena cava, so the venous blood that drains down from the head and neck, and it lands in the superior vena cava, and then the blood that is deoxygenated blood that's coming from anything lower than the shoulders comes into the inferior vena cava, and all of it gets mixed together, and then it's, of course, travels on through into the pulmonary artery. And so the blood in the pulmonary artery can be measured. Again, please remember that this is not arterial blood. This is deoxygenated blood, and it is considered to be a venous sample. And we can measure the oxygen level that is in this venous blood, and it is known as the SVO2, or mixed venous oxygen saturation, or just venous oxygen saturation. So why would the mixed venous oxygen saturation measurement be done? Well, it provides information about the cell's use of oxygen. If you think about oxygenated blood that's on the left side of the body, on the arterial side, and then it travels all the way through the body, and then as it travels, it drops off oxygen, and then as the cells use that oxygen, then the deoxygenated blood returns to the right side of the heart. And if you consider that whatever is not utilized or taken or extracted of oxygen from the arterial side, then if we measure what's left over in the venous side, it tells us a lot about what's going on at the tissue level. Now, normally, the body or the cells of the body, all of them, they don't use more oxygen than about 25 to 35% of what's available to them of the oxygen. So if you think of the arterial side as having 100% oxygen, and then if you measured it on the venous side, the normal oxygen saturation in the venous blood or of the venous blood would be in the neighborhood of 25% less, so that would be 75%, or 35% less, which would be 65. So the normal mixed venous oxygen saturation in many resources lists at 65 to 70%. Now our course lists as 65 to 80. So it doesn't really matter. The point is that oxygenated blood on the arterial side drops off oxygen at the cellular level, and then as it makes its way back to the venous side of the right heart, then it should be less than what's been or what was on the arterial side. Our course lists 65 to 80%. So this is kind of a picture, a visual image of what I was telling you, that here's the left side of the heart. And if you think about the blood that's in the left side of the heart as a UPS truck, and it's got 100 oxygen packages on it because it's filled up at the left or the lung depot, and then it makes its way around on the UPS truck. It'll drop off oxygen at the tissue level. That's what those feet represent. And then again, if we measured how much is left of the oxygen packages by the time it made its way back around to the right side of the heart, then it should be mixed venous oxygen saturation should be in the 65 to 75% range. Well, what happens if the value is far lower? If it's 50% or 40%, what does that mean? Well, it means that there has been a lot more oxygen that has been delivered to the cells. So what could be happening at the cellular level where the cells would demand more O2? And the reasons or the causes for increased oxygen demand or extraction from the oxygenated blood is if a patient has an infection or if they have a fever. These things increase the metabolic demand of the cells. If the patient is shivering, if there's pain, if there's stress or lack of sleep. And of course, if an individual is exercising, those muscles need a lot of oxygen to get through a marathon, say. So that's the reason why the venous oxygen saturation would be lower than normal if there was a greater demand at the cellular level. Of course, if there's a time when the venous oxygen saturation can be lower, there can also be a time when the venous oxygen saturation could be higher than what it would be. What does this mean? Well, it means that for whatever reason, O2 is not being dropped off at the cellular level. It could be because the cells don't need it, such as in hypothermia. If an individual was ice fishing in Minnesota in the middle of February and they fell in through their hole of where they were fishing, then they would become profoundly hypothermic. The cells would use far less oxygen. And so this is why individuals who drown in freezing water are resuscitated, even though there's been a report that they've been in that water for much longer than 5, 10, 40 an hour, because these individuals do have less O2 extraction, and so therefore there is a chance that there could be survival. Other reasons why oxygen extraction or oxygen delivery at the tissue level would be far lower is in causes such as cyanide poisoning and sepsis. I hope this has been helpful. If not, email me with your questions.